so I'm going to sort of talk a little bit about epidemiology and COVID-19 and what sort of implications that has for us as Texans, for those of you who are working in rural areas, so that we actually can, sort of think about how do we plan in order to do the best for those we serve. So I'm going to just sort of much of the stuff you actually know about, but we'll just sort of orient us to COVID and sort of how it started, which was not that long ago at all, but how it really now is impacting the entire world. As you know, COVID-19 is a coronavirus that was first reported or seen in Hubei province in China, in a city that everybody knows now in Wuhan. And quite quickly, it really began to consume the entire province and city. And by the January 20th, which is when a bit after we began knowing about it widely in the US, it was all over China. And so that was both good news, that's bad news, because it was clearly passing and transmitting very, very fast, and it was quite deadly. But there was also sort of a silver lining there too, because we, as a global community, and even here in the US, know how to control epidemics. And so this is something that we're quite comfortable with, because we've actually done it quite a lot. And most recently, we did it in 1918. And this is a century ago, but this is really where we cut our teeth on controlling pandemics. And this was the Spanish flu, and you've probably heard a lot about this, but this was over about 2 years, from January 1918 to December 20th, and sort of really pointing out that this did not go away quickly. It ebbed and flowed, and really was around for quite a while. About 500 million people were infected, which was about 25% of the global population at that time. And about 17 to 50 million people died. So it really had a huge impact on the world and changed things as we knew it then. There are some estimates that it may be, up to 100 million people who died, because there were really sort of no clear indications. Certainly in my own family, my mother had an uncle who went missing around 1918. And nobody ever heard from him again. And it was just assumed that he had died in the Spanish flu and was probably thrown in some pauper's grave. But lots of people were just sort of missing, and we didn't know what happened to them. And people thought this would never ever happen again. And lots of safeguards were actually put in place around that. This time, so that this would never happen again, lest we forget. However, there was a lot of things that we actually learned from this pandemic. We really learned how to avoid these things. So this on this left-hand side, you sort of see containment. And early when you see these flus or these epidemics coming, you really try to contain it. You try to find where the cases are. You try to figure out who they've had contact with. And then you try to figure out what the illness is. And then you really want to isolate them. Because if you can isolate them, you can stop the disease transmission before it takes hold. However, as you begin to go to the right, transmission really begins to outpace your ability to contain it. And that's actually what began in Wuhan, and then it really spread throughout the world. And at that point, you are then trying to mitigate it. You're going to try to treatments, but then you're really going to try to mitigate it with these non-pharmacologic interventions that we are going to talk about. Each country and each has the ability to contain it. So for example, a few years ago when we saw Ebola, it was isolated to a number of different areas, but by being contained there, it would pop up elsewhere, but they contained it really, really well. It's kind of like having weeds in the yard, or things with dandelions. You know, as soon as they pop up, you got to get rid of them, because if you don't get rid of them early, they just basically take over everything. And that's where we are with COVID-19. You've sort of seen charts like this in the news. This big purple thing in the middle, this is actually what happens if you don't intervene, you do nothing. You get a lot of cases and they come on really, really strong, and it will overwhelm the system. And then this stipple thing to the right is really when you can spread out the cases over time so that it doesn't overwhelm your system. And that's actually what we're trying to do now. We're trying to flatten the curve. We want to reduce the likelihood that people will get this, so we don't overwhelm the system, because if we overwhelm the system, people will just die because there's no system to care for them. And so that's actually really the focus of these non-pharmacologic agents to control this. There's three major ones that they used in 1918, quarantine and isolation, school closures, and then social distancing. And those are the main things that we still have in our armamentarium to control this. Quarantine, closing schools, and social distancing. It worked really, really well in 1918 for those places that actually did them. One of the things that you can see here, this is 1918 data from the US. If you sort of look at the East, and that's the red one, it spikes, it goes up, and then it actually went down with the mitigation techniques. However, you can also see, like in the West and the South, Midwest, you see those like double peaks. You can I'll sort of point can you see my cursor? You have a peak here, and then you have another peak here. And this one, green one, you have a peak here, and then another peak here. These were caused by the mitigation techniques being put in place, and then people being anxious to get rid of them. So they stopped them too early. And then when you stop them too early, the deaths began roaring back. And so once you put your things on, you have to really keep them on until the virus is gone. Otherwise, all it does is come back. And fortunately, we know sort of the natural history of the virus, so we can predict what we're going to get. Does that make sense? And probably what you're hearing here in the news as well. So that's actually the good news, is that we know exactly how to prevent these things and then treat them non-pharmacologically once they start. So what does this mean for us in Texas? Because we're different, we're special, as we've always been. And want to sort of talk a little bit about Texas and what we have here. One of the things that, this is 1917, these is acute care hospitals in Texas, and these dark blue areas are the places where there are more than 25 to 69 acute care hospitals. And then there are some much lighter one where there's 1 to 9, and then there's a number of white ones where there's 0. When you kind of look at this, what is this? What does this tell you, Chris?
It tells me that if you live near Dallas, Houston, Austin, San Antonio, or in El Paso, you'll have access to medical care. But if you're in the rural communities, you might not.
Yeah, yeah. So yeah, exactly. So if you are in a major a city, there's going to be lots of acute care hospitals to go to. But if you are not, and many of the communities that you serve are not, you're at much greater risk because your system may get overwhelmed. This right here looks at these acute care hospitals, and what you can see is that 75% of them are in metropolitan areas, and 25% are in non-metropolitan areas, and that's actually the closest we get to them calling anything rural. Of this, you see there's about 565 hospitals. That constitutes 80,000 beds. However, the metropolitan hospitals have about 174 beds per hospital, and these non-metropolitan hospitals have about 51 beds per hospital, meaning that of all the acute care beds in the state of Texas, only 9% are in non-metropolitan areas, which is the areas where you serve it. So that makes your communities particularly vulnerable, and why that we really need to sort of focus there and sort of think about how do we care for these communities, both medically and educationally, because they're intricately tied. And I'm going to sort of, talk about this in a moment as we go on. So I'm going to sort of talk a little bit about projections for the U.S. and for Texas. And there's some good data that is available. Let me just sort of, we've been talking a lot about New York and the news. Let me just say a little bit about New York here and why this is such a problem for New York. If you look at hospital beds, so hospital beds, this is how many hospital beds they have. This dotted line number is the number of hospital beds they need. And so that's actually why we're hearing that EMTs are not necessarily sure what to do with people, because they know the system is going to be overwhelmed. And we're just here. This is where we are, and they still have a ways to go. ICU beds, you can sort of see their ICU beds are here, this bottom line, but their needs are much greater than that. And that's actually part of the reason why they're converting entire hospitals to deal with COVID-19 in New York, because the entire system being overwhelmed. They're creating these field hospitals in Central Park and at the Javits Center, taking over huge areas to just make hospitals in order to care for these people. And obviously the other problem they're having, that we're going to have as well, is that your providers are now getting sick. So you have fewer people to care for them. So going to Texas, we see something a little bit different. Here, what we can see is it actually quite looks good. This top line is the number of beds we need. And this bottom line, the top line is the number of beds we have. This bottom line is the number of beds we need. However, as Chris pointed out earlier, most of the beds we have are not where you are. They're actually in our major cities. And so even though it looks like we're going to have more than enough beds, this may not be the case depending upon where you are. ICU beds, we see, is problematic even under the best circumstances, because many people need to go into an ICU. You can see when we reach our peak, around the beginning of May, we're going to have more need for ICU beds than we have. And this is going to be particularly problematic in our non-metropolitan areas where you live because you don't have that many. And we can also see deaths per day. We're going to end up, when do we hit our peak? We hit our peak on May 5th. And you can see on May 5th, are we on May 5th? May 5th, we're going to have 153 deaths per day. May 5th may sound like a familiar day for us here in Texas, because we just heard yesterday that something happens on May 4th. And Darren, what's that? Because I think you're the one who told me. Or anybody?
I didn't hear you there.
On May 4th, what's supposed to be happening? The governor talked about it yesterday.
Oh, when we go back?
Yeah. So
hopeful.
Okay, so
it doesn't look realistic there.
Yeah, so here's May 4th. May 4th is right here. We're going to have 152 deaths per day, and we're not going to be at our peak. What's the likelihood of us going back on May 4th?
Zero.
Zero. Zero. Zero, zero, zero. And that's why it's really important that we follow the epidemic and listen to the epidemic and allow the virus to teach us, because it's going to tell us a whole lot more than other ways that we can find this out, like edicts from our elected officials. Follow the virus and it will teach us, it will tell us what to do. You can sort of see that, you know, when does school end? When's school supposed to end?
Right at the end of May.
I'm sorry, what?
I said right at the end of May.
Yeah, so right at the end of May, we're still gonna have like 81 deaths per day. And you know, this doesn't even, and this is assuming that all the mitigation things are in place. If we come up here, we can sort of see the things that we know work for mitigating these pandemics is quarantine, staying at home. That hasn't been implemented throughout the state. Educational facilities closed. That has been implemented on March 19th. Stopping essential services and severely restricting travel. These have also not been implemented. So this is the best case scenario, assuming all these things happen, but what we're seeing is that all these things are not happening. Any questions before I move on from this, this particular one?
So Doc, basically what you're saying is, since all those solutions haven't happened at the top, then this is probably going to last longer than July 1.
This is going to last a long time.
Until we do these.
Yeah. So we haven't done all the basic stuff. There's still this sort of exceptionalism happening, that this isn't happening in rural areas. Why do we need to do all these things? This is a big city problem. However, what we know is that this is a all people problem. And we have, you know, people, we have our principal, one just died yesterday in Waco. This is affecting our communities, but we aren't testing for the virus in most of our communities. Most of your communities, we're not testing for it. So we don't really know how prominent it is. And then just yesterday, we heard that maybe up to 40% of people who have the virus and who are transmitting the virus are not having symptoms of it. So this is actually happening without our knowledge. So this is likely already widely spreading in all of our communities. Roosevelt, did that answer your question?
Yeah, it did. It did.
Any other Questions,
I have
comments?
other questions that I'm not getting clear information on because you have so many different resources that tell you things about COVID-19. So,
Okay, good.
but yeah, but anyway, I'll type them in there later also.
Any other questions while I have these particular resources up, and then I'll move back to the slides.
Well, I just wonder if you can have this in bullet format, bullet points for us, that we can extract it and use it to communicate things a little differently.
Yeah, and no, so I don't have this any differently, but I can link you to some resources that I think are really good.
Dr. Bean,
And I've not heard any thing like this on Texas rural areas in education. So some of this was me sort of pulling it together, but I'll give you what I have. Chris, did you have a comment?
I was going to ask just for clarification, what was the website again?
For this green thing?
Yes.
Yeah, so this is, if you do Institute for Health Metrics and Evaluation.
Got it. Thank you.
Got it?
Yes, sir.
So, and this is a really good one.
Mm-hmm.
So let me just share, go back here. And just sort of, finally, one of the things that we learned, yesterday with the governor's address. 1 second, I'm sorry. Is that as of May 4th, they are proposing bringing reopening Texas schools. However, that's still to be seen. However, a number of states have already said that they are not planning to come back this school year. There are 7 of them. If you look at most places, it'll say there are 6, but Oklahoma sort of quietly said recently that they aren't coming back. There's no date for return for California, New Jersey, North Carolina, Pennsylvania, although California just said yesterday that they're probably not going to come back, and I think it's probably true for the other ones as well. And then most states have various proposed returning dates. However, the virus may tell us quite differently.